This week, a young nurse in Tennessee caught our attention. She's been working endless hours on COVID's front lines, fighting the virus and trying to save lives. Tonight, Phil Williams of CBS affiliate WTVF in Nashville shares her story and her frustrations.
Catherine Sherman has a story you need to hear, which is why I asked her to record this video diary at the end of a recent shift. She's tired, she's frustrated, and she's angry.
I just got off of work. The last 3 shifts have been very busy.
You can see the exhaustion in her eyes. Just 1 year out of nursing school, Catherine Sherman is already a veteran of life inside a COVID ICU.
It feels like we didn't learn a thing. We didn't learn a single thing. We're right back where we started.
It's a sense of frustration that comes from now watching the unvaccinated fight for their lives, a battle that's in some ways lost, even if they do manage to survive.
I'm talking about the people who survived COVID, and now they're going to be dependent on oxygen the rest of their life. The people who survived COVID, and now they're going to live in a nursing facility for the rest of their life because of COVID, they had an anoxic brain injury. And now they are so brain damaged that they cannot care for themselves.
After seeing patient after patient in the same predicament, Catherine is also fed up.
I'm out of tact. I'm out of compassion for a lot of these people. And I'm not talking about my patients. That's a different story. The second you become my patient, it's totally different. I'm talking about the people who actively spread this mis and disinformation. I'm talking about the people who, even when they have a loved one in the hospital with COVID, you know, they're like, "You're not going to give her that vaccine though, are you?" Like, no, we're a little bit past that, but it may have helped her in the first place.
But what angers her the most is her knowledge it didn't have to be this way.
I don't know what else to say. There's nothing poetic here. There's no great revelation. There's no like beauty here. It's just people dying who don't need to die.
Catherine says that when cases subsided earlier this year, she realized that the ICU was not always a place where death stood watch. But these days, she says, death is back. For CBS News, I'm Phil Williams in Nashville.